Hey everyone, this is Daniela from the Obstacle Doc, and today we're going to talk about how to assess and work through hip extension, specifically through glute bridging. When we are talking about extending from our hips, we are trying to use our primary driver, which is our glute maximus, along with our glute medius and minimus, the smaller muscles. And so we're going to demonstrate that lying down through a bridge exercise, and not to be confused with the bridge pose, and I will show you what that looks like. So for our glute bridge specifically, we are trying to drive up from our hips without using our lumbar spine through extension. So I'm going to show you what that looks like. So this would be a classic bridge pose, maybe in yoga, where we are pushing our hips as high as we can, versus our glute bridge for our hip extension exercise. We're going to use our muscles to squeeze and then lift us up. And you can notice there is a bit of a difference in the height. That's totally fine. That's going to be pretty normal for most people when we're moving through control. So to start just assessing what our glutes can give us through hip extension, we're going to start laying all the way down. And what you're going to do is try to isometrically contract the muscle. So we're going to start laying down, legs extended out, and we are going to just try to squeeze our butt cheeks underneath us. So you're going to pretend like there is maybe a penny between your butt cheeks or a $100 bill somebody's trying to take, and you're going to squeeze and release. So what you might feel is your hips lifting up a little bit away from the ground as the muscles contract and get taut underneath you. You might feel some movement in your heels. Your glutes do external rotation, so as they do so, you might feel a little bit of that turnout in your feet, and that's all perfectly normal. Once we find it through both sides, we're going to try to go just left and then just right. So try to squeeze the left side and then just the right side. When we're doing this, we're trying to feel for differences between either sensation of how punchy something is feeling, how tired something's feeling, how easy it is for us to tell our body, hey, this is what we want you to do. So go back and forth between your left cheek and your right cheek and see if you can feel any similarities or any differences before you go to the next step. So to put this into practice, we're going to bend our knees. You're going to get your feet flat on the ground. And what you're going to first do is squeeze from your bottom before you lift up off the ground. This might be difficult because of the angle of your hips now, because you are in flexion. Your muscle fibers are a little bit further apart. They're in a stretched position. So it might be a little bit more challenging to scoop them underneath you. So we're going to squeeze. Keeping that squeeze, we're going to lift up only as high as our bottom can take us, right? Not as high as we can go, just where we can extend purely from our muscles. And then we're going to control the way down with those muscles still turned on. Once we touch the ground, then we can release. So it's a squeeze, a lift, a lower, and then a release. When we are going through our double leg squeeze, lift, lower, release, we want to be monitoring our hamstrings, our quads, and our inner thighs for how much or how little they're doing. They will be assisting as an accessory to the glutes, but we don't want them to drive the movement. We want to keep the movement as purely as we can through the glutes to lift and lower you, rather than pushing through your quads to bend through your straighten through your knees, or to use your hamstrings to extend your hips as a secondary driver. So once you've done your double leg assessment, we can bring our feet all the way together just to start from a place of balance. And then we're gonna hug a knee to our chest. The reason that we hug the knee to our chest is to lock down the lumbar spine so that if your leg is floating, you're not tipping or tilting your pelvis through space. So we're gonna hug our knee, and then we're gonna do the same thing with the single leg. We're gonna squeeze, we're gonna lift, we're gonna lower, and then we're gonna release. You can do that a couple of times on one side and then switch, do the same thing. When we're doing our double leg bridge versus our single leg bridge, we want to appreciate the height as well as the effort and then the level of our pelvis. So when we are lifting and lowering, we want to monitor how much we are tipping or tilting from one side up to the other with our pelvis through that single leg as well as our double leg. It would be very normal for your single leg bridge to be a little bit lower than your double leg bridge, but the goal would be that you can get them to even out over time. So this double leg versus single leg hip extension through your glute bridge can be used not only as an assessment, but also as an exercise to practice and prepare for bigger movements like your hip hinge, kneeling hinge, deadlifts, so on. The other thing that we can do is progress this into a single leg march from your double leg extension. So you're gonna start with your feet, maybe not all the way together, but a little bit closer than they were before. You're gonna lift your hips up into space. This is a really nice way to also assess and challenge the dynamicism of your hips holding you still. So we're gonna keep our feet planted, Hands can be on the ground, and you're going to lift one leg, bring it back down, and then you're going to lift the other leg and bring it back down. And again, noticing what's happening at your hips. If we're dropping, if one side starts to take over from our hamstrings, or maybe your inner thigh starts to talk more to us, then we might have difficulty with maintaining that hip extension when we are moving through space. So we don't want to confuse this with a yoga bridge pose, which is pushing all the way up through extension of your hips and your lumbar spine, where you're trying to get as high as possible. This is a common thing that we see in group fitness as well as just in practice, is people are trying to get their hips as high as they can. If you have really tight quads, if you have a really tight hip flexor complex, it is going to be harder for you to break through that with activation from the backside, because it's almost like a rubber band holding you down into flexion. So again, we're not trying to get as high as we can. We want to keep our spine neutral. We're just going to squeeze, lift to where we can, and then lower back down.